Hi, my name is Brittany Torrijos, and my presentation today for Public Health 1 will be on the public health issue of childhood obesity. Childhood obesity exists and is very prevalent in today's society. The percentage of children in the United States with obesity has more than tripled since the 1970s. 17% of children aged 2 to 9 are obese, which equates to about 1 in every 5 children. The highest rate is among 12 to 19-year-olds. There are many causes of childhood obesity, including genetics, lack of physical activity, excessive inactivity, poor diet, and environment. Instead of eating high-calorie, low-nutrient foods, children need to be eating more fruits and vegetables. Also, instead of watching television, children should go outside and participate in sports. Childhood obesity is a global issue, affecting both industrialized and developing countries. Poverty-stricken regions, including Africa, face obesity as well. Their rate ranges from 10 to 20%. There are many risk factors for the community in the future. Childhood obesity often leads to complications including pulmonary issues such as sleep apnea and asthma, as well as cardiovascular issues including hypertension. Obese children often become obese adults, which then leads to such chronic diseases as diabetes type 2 and heart disease. It is very interesting to learn that type 2 diabetes, which primarily was only diagnosed in adults, is now being diagnosed in children. The etiological factors include increased prevalence in lower income neighborhoods. The rate of obesity was 21.9% among Hispanic children and 19.5% among African American children, compared to 14.7% of whites. Children that live in lower income neighborhoods have a higher risk of becoming obese. The first strategy to help solve the problem of childhood obesity is to regulate the marketing of unhealthy foods and beverages to children. Research has shown that exposure to 30-second commercials increases the likelihood that 3 to 5-year-olds would later select an advertised food when presented with options. Commercials for fast food and soft drinks need to be replaced with commercials of fruit and vegetable options. The second strategy is to encourage physical activity. According to ACSM, children need to get at least 60 minutes per day of physical activity. This could include transportation and sports. The first cultural example of how to solve the problem is from Colombia. On Sundays and holidays, they close main streets to encourage physical activity and to encourage people to ride their bikes, to walk, and to run. The second cultural example is from Australia. A Better Choice is a program they implemented which serves healthier meal options, including whole grains and more fruits and vegetables at government-run facilities, including hospitals. Research literature states that we must focus on primary prevention strategies, including promoting physical activity and proper diet. Furthermore, there needs to be more of a focus on school intervention programs, including establishing stricter standards for lunchtime programs and eliminating unhealthy foods such as junk food and sodas from vending machines, and having healthier options in these vending machines. In my opinion, childhood obesity is a preventable disease. Since the demographic most affected are children who come from low-income families with low socioeconomic status, efforts should be targeted directly at them. These efforts should include building safer playgrounds and making healthier food options more affordable. Thank you for listening to my presentation on childhood obesity.